So I worked on a UCL tear. So a UCL tear is an injury to the ligaments on the inner side of your elbow. Okay, this inner side supports your upper arm and your lower forearm. And your forearm. But so the ligaments that are affected are. Just slide real quick. The ligaments that are affected are the anterior bundle and the transverse ligament. You can see that right there. It creates a tear. Okay, and like rehab and prevention stuff that is based with this UCL tear are, one is the modified side lane crossbody stretch, which is this. And what that does is the athlete lays on his affected shoulder side and stabilizes the scapula by rotating posteriorly against the table. The shoulder is horizontally abducted, and external rotation is restricted via counter pressure of the opposite forearm. So you hold that for 30 seconds and you repeat that 3 times. In figure 1, the next modified stretch would be the modified sleeper stretch. See how that is? And the athlete lies on her side, and then with that, her scapula is retracted, rotates slightly posteriorly to place the shoulder in scapular plane, and passively internally rotates the shoulder until a mild stretch is felt. And you hold that for 30 seconds, relax, and repeat that for 3 times. And for a rehab program, I used Massachusetts General Hospital program, and they have a 5-step phase program. They have 5 steps phase. In the first phase, we want to protect healing tissues, decrease pain, inflammation, and protect the site of injury. So to decrease inflammation, you want to use ice or heat, and really use a inflammation medication, anti-inflammation medication to help decrease that inflammation in that elbow. For the phase 2, you want to gradually increase full range of motion by a 4 to 6 week program. To help with that, we'll use a brace, and the exercises that you can do would be forearm strengthening. So forearm strengthening, so I'm gonna show you wrist flexion. Wrist flexion, it's like this. You just wanna flex the wrist. And I would change this exercise by adding more weight and just really increasing that range of motion. Maybe adding a count to it to increase difficulty. I would lighten the weight so the athlete can get used to the movement and exercise and really exercise this elbow. There's wrist active motion, flexion, and extension. So the athlete will hold his hands above his head like this and just flex, really stretching that elbow ligament. Increase that. I can add weight or add a ball and bounce the ball off the wall and really work that muscle. That's what that. Some exercises to go along with that. This is the rehab photograph, rehab from Michigan. And it's a 5-stage process. So the second phase is a post-op, so after surgery, but the first phase is before surgery, or immediate post-op is 0 to 3 weeks after surgery. That's how they do. For the third phase, it's 6 to 12 weeks after surgery, and the fourth phase is advanced strengthening. which is 12 to 16 weeks after surgery. But the fifth phase is like a throwing program that most incorporate with the UCL injury, because most injuries that require or that cause a UCL tear are because of a throwing exercise or in-game injury.